one of the fourth dimensions of the 4D City project, based on how health and innovation can promote, can foster the economic and social development. In this transnational meeting in Jena, we have been working on how the education system and the universities can promote an innovative health sectors. Actually, we have been checking and trying to find out how universities, training centers and continuous training programs can match, can fit with the new demands of the health sector. Besides, we have also been working on how can we make knowledge capital available, and we have been also working on how or which are the best tools that City Council can use to make the interaction with the different actors, let's say entrepreneurs, business, professionals, volunteers, patients, to get the best answers to the new demands. From the point of view of Igualada, we do not have a specific university from the health sector, but we do have the different actors of this area, of this field. What we are trying to do is to interact with all of them. Actually, thanks to the URBACT project, with some of them we are going to discuss and have meetings with them for the first time. And our project, our main project related to knowledge and the preparation of the professionals is the 4D Health project, this new innovation simulation center, where we are intending to attract companies to prepare the professionals for the new demands of the health sector, always putting, settling the patient on the center of all of this.
So we have the ingredients for a world-class, knowledge-driven health system. We have excellent information on patients held by two market leaders, EMIS and TPP, two private sector companies. We have a world-class university which is leading on a big data computing project focused on health. The challenge for us is to make sure that we combine the technical expertise that we host in the city with citizen engagement. So we need to make sure that citizens are deeply involved in those very specific projects of big data and a single health electronic record.
Novara has a strong tradition about knowledge coming out from its companies, big companies as well as SMEs. There are existing networks between these companies and technical institutes, while the university is just a sort of newcomer on this network because it's the youngest actor of our helix, and we are working hard to increase these activities, to improve this network, and the university is a promoter of a business incubator that is the local hub for managing this network and transferring technologies from university to enterprises, and even to spread this technology and to the citizens, to the city, and to foster all the local economy.
In Tartu we have University of Tartu, which is the oldest university in Estonia and also the largest one. It has a very high-level research in different fields. Besides Tartu University, we have Estonian University of Life Sciences in Tartu, which is also pretty big. And besides that, several other higher education institutions, like, for example, Healthcare College. And what we would like to achieve more is probably the cooperation between the institutions of higher education and research and the other institutions in our city, like the city government, for example, and businesses, companies. And yeah, the main goal would be to use more our potential.
It is a pity that didn't have no universities in our town Plungė, but we have still a lot of universities in Lithuania, and it's possibility for our people, students and old people to go to study in other towns of our Lithuania. But we have our third university, old of age, for old people. Yes, we have our professional technical school. Then you can have our knowledges of training.
Well, in our local support group, the technical university is involved and the industrial design part. So we introduced the design thinking in our local action plan, and they introduce a way to co-create with the citizens the way we want to foster an active and healthy way of life for them in the neighborhood. And they also involve students, and they help us to get the interaction with the citizens, ask the questions, and they making use of the neighborhood as a living lab, as an action research which they do there. So we can really start from what the citizens need, and we can start from their demands and the things they want to have for their neighborhood to create an active life and a healthy life.
We have as knowledge provider, of course, some strong stakeholders already here in the city. We have the 2 universities, we have networks who are combining industry and research companies and research institutes from university. We have schools and other partners who are relevant as knowledge provider, of course also our teaching university hospital. But what this session brought to me today is the last day, yesterday and today, that it's also important to look at the citizen as a knowledge provider, because we have to include them better in the whole system and ask for their needs, for their experience, and for me that's also some knowledge. We don't have to keep that out of mind. And of course our next task will be to put up some stronger network between these partners, because so far it was not so established here as a network in the health sector. We have different small networks, but not a bigger one which has perhaps the citizen in mind. They have all individual targets.
If I compare the possibility of city by Asprilla with our partner possibility, I have to admit we have very short possibility, but because we don't have university, we don't have the possibility to use the knowledge of teachers. But I know we have a lot of students who it's involved in a national project, who live in Asprilla, and maybe we use them when they come back at home. So for the moment we don't have a lot of possibility, but in the future, because we are here and we learn about how to use these skills and student skills, I'm sure we use the potential which the students from Asprilla they have.
that the knowledge capital available, being university faculties, being training, secondary training centers or any lifelong learning programs, have to meet the needs of the health system for the city. So when sketching out an urban model based on the health sector, we have to foresee, or cities have to foresee, which are the skills and the competencies that the health stakeholders in the city require. Also, we focused on the importance of the knowledge clusters and the strong interactions with the business sector. So we could learn from the model in Tartu with the Living Lab and the competence centers, and Jena itself, the host city, with strong public-private partnerships in both of them. But also we discussed the fact that not all the cities have a university campus or sites. We agreed that there is not a single education system that is the best for health innovation. It depends on the starting point of each of the cities. In the case of Igualada or of Vallespri, without having these university centers or research in place, they have started to work on a model based on social innovation and based on citizens' engagement and participation and co-creation of the health services and the health model.
Concerning the topic about the relationship of knowledge and health, we concluded 3 issues. First of all, we have to talk about competences, not about knowledge, because competences, when we talk about professionals of health or any type of professionals, competences included knowledge, abilities and attitudes. So we have to manage all non-technical and technical competences. The second one, all the stakeholders must be implied in the design of the curricula of the students of different professions of health. We must consider hospitals, ambulatory care, primary care, hospital, emergencies, home care, etc. And third, and finally, we must think about patients and citizens included in this design. Well, most of the times, when we are designing the curricula, we take into considerations all the experts in the university and sometimes the experts in the hospitals and about health facilities, but very rarely we consider patients or citizens. So it's very important to put the patient or the citizen in the center of the knowledge and competences of the professionals of health.